Good afternoon and welcome to your 2019 professional development. I'm Jade Dabachek and I'm here. I will be going over the WIAT 3 assessment with you today. I'm going to go ahead and just jump into an overview of the assessment. So the WIAT 3, also known as the Wechsler Individual Achievement Test, is the most recent achievement test that we use and that is out currently. So, couple things to know about the WIAT 3 is that it's used in different settings. So there's a variety of settings that it can be used in. There's clinical, educational, research-based settings, which includes schools, clinics, private practices, and also residential treatments. And we do currently have psychologists throughout the district who assess some of our students at nonprofit schools, so our NPSs, who would go out and give this assessment. It's used for a wide variety of reasons, but one, because it identifies the academic strengths and weaknesses of a student. It informs decisions regarding eligibility for educational services, educational placement, and the diagnostic of a specific learning disability. The design of the WIAT is an instructional objective and with planned interventions. So overall, that's the overview of the Wechsler Individual Achievement Test, and we're going to now go through some of the background of it. So why the WIAT? Well, the WIAT psychometric information is based off of national norms. So there's a lot of information here that I'm going to review with you, but most importantly is that this assessment was nationally standardized when it was given to 3,000 students and adults, and it featured comprehensive normative information. The WIAT correlates with most of the intelligence assessments that our school psychologists give here in Saddleback, and it measures ability with the alignment of the intellectual intelligence scale. So some of the assessments that we have from the Wechsler Preschool and Primary Scale of Intelligence, which is the 3rd edition, and also our 4th edition. The study included in the WIPC was the Technical and Interpretive Manual for that assessment. The Wechsler Intelligence Scale for Children in both the 4th and 5th edition. So we have the preschool scale, but then we have from kinder up, that would be the scale for children, and that's for the intelligence test or their intellectual ability range. And then there's also the Wechsler Adult Intelligence Scale, and that's the 4th edition. We also have an assessment for nonverbal scale of ability, so our nonverbal test that we need to give, and then also differential ability scales in our 2nd edition of that. And these are all the most recent assessments for Pearson to have at this time. So they're clinical studies. So who takes the WIATs? There's 3 different professional developments going on today. There is the Woodcock-Johnson training. There is the WIAT training, which you're all at here today. And then there is also the Brigance training. So in our district, we follow, although here you're seeing the age range of individuals from ages 4, literally 4 that day, to 50 years old and 11 months can be given this assessment. In Saddleback, we like to give the Woodcock-Johnson to students that are in kinder or preschool. So we do not give this assessment to our students who are 4 years old or 5. We will, however, start using the WIAT for ages 6 and up. So from 6 all the way to grade 12. Yes, the range does say 4, but in our district, this is the model that we follow. This is used as a guide, and it's used for teams decisions. And it can be based on other factors, but if a student who we're assessing, we believe that there is a processing difficulty with a student, then this is something that we would look at, even if they weren't necessarily, let's say, qualifying for special education services. It would still be information used for the team on how to support that student and their learning. With that being said, is this an assessment we would give to anyone that we have concerns with? No, there should be other grade level diagnostics and assessments from the grade level publishers that should be used to monitor and support student learning in the classroom. So, things to do when getting ready for the test. Really important things to remember about giving the test, and especially for the little kiddos, is that they test better in the morning. We can't all have a testing block at first thing in the morning, so even if you can do, out of the 3 to 4 days that you're assessing a student, if you can get one session in the morning, it is important to see maybe giving some of the more difficult passages to that student, things that they might have more difficulty with, not necessarily difficulty on the assessment itself. It would be a great time to give that to them would be in the morning. Trying to assess for multiple days. It is not in the best interest of the child to be given an assessment in which they assess for 3 to 5 hours in one day. Statistics show that they will not do well, which is why even our state testing, we've changed it to multiple days throughout a month even to give them that assessment so that they have mornings and afternoons to do their best on a test. Making sure that we have time in our weekly or daily schedule for testing. You might not have it every day, but have it planned out that on 1 to 2 days a week that you can pull a student in the morning or in the afternoon to get that assessment done. It's also important to test without distractions. So making sure that when you're in here, just like right now, there's no one interrupting, there's no bells going off, oh, it's 5 minutes till recess. That's not a good time to pull a student for testing. They will continually ask you if it's time for them to go. Is it my recess? Is it lunch? So it's important that they get the time that they need and they don't feel rushed through the assessment. Also, the length of time definitely depends on the ability level of the students. So at times we might have students who do really, really well on some tests and it takes a really long time. We don't always know that, but we should gather that information from our own data or from the general education teacher's data, and we should know when to give an assessment and when to allow that time. So if they're doing well, that you assess them and give them the time to do it. With that being said, if a student, we're not concerned with their math skills, we're just concerned with their reading or writing skills, it is important that you give a full assessment when giving the assessment. We need to look at a wide range of ability level, and when we go through the breakdown of the assessments, I will even show you reading comprehension versus math problem solving. Even though I've had students who in the past do not demonstrate any difficulty in math, I still give all the math assessment subtests because it's important to show a family the range that when an accommodation is giving, such as reading aloud, like the math word problems, which are read aloud, that we can see how that child's understanding is and where their ability range falls. Okay, so things that are needed for the assessment. Testing material, you should have all of it ready to go when you have that kiddo in front of you. You need to be ready because they're ready. So we need the stimulus book, we need the writing scoring booklet, we need the word card, you need your pseudo decoding card, you need your audio CD, and you also need your record book and the response book. The record book is for the teacher to write in, and the response booklet is for the student to write in. So you need both of those, and when you're bringing them to an assessment, you need to have those so you can show writing samples as well. You'll also need the oral reading fluency book. It is important that we get that subscore because it's pulled together into other composite scores in which we will look at when getting a full scale score for students and student learning.